According to research data, nearly 10% of newborn infants have a hydrocele, which often clears up without treatment within the first year. Hydroceles occur in only about 1% of adults. In this video, we will talk about this disease, hydrocele. By answering these questions, what is hydrocele? What are the types of hydroceles? What causes hydrocele? Symptoms of hydrocele. How is it treated? What is hydrocele? A hydrocele is a sac of fluid around the testicle. It's a type of swelling in the scrotum, the pouch of skin that holds the testicles. A hydrocele may affect one side of your scrotum or both sides. Another name for hydroceles around both of your testicles is a bilateral hydrocele. Hydroceles are usually painless, often disappearing without treatment. Hydroceles are divided into two types, communicating hydroceles and non-communicating hydroceles. A communicating hydrocele has contact, communication, with the fluids in your abdominal cavity. Your abdominal cavity is the space within your abdomen that contains your stomach, intestines, liver, kidneys and other organs. Communicating hydroceles occur in fetal development. During development, a thin membrane forms between some tissues in the fetus stomach lining, inguinal canal, and the scrotum. This membrane is the processus vaginalis. Normally, the testicles slide, descend, from the abdomen through the processus vaginalis into the scrotum. Tissue then forms to seal the opening, communication. If a seal doesn't form, fluids from the abdominal cavity can flow into the scrotum and cause a hydrocele or hernia. Non-communicating hydrocele. In a non-communicating hydrocele, the processus vaginalis closes, but there's still some extra abdominal fluid around the testicle and the scrotum. Non-communicating hydroceles may be present at birth or develop years later for no obvious reason. If you or your child has a non-communicating hydrocele, it usually remains the same size or grows very slowly. What causes hydrocele? Hydroceles can occur at any age, yet tend to be more common in newborns. While they can occur without any underlying causes, an underlying injury or even inflammation can also contribute to their development. Often the only sign of a hydrocele is a painless swelling of one or both testicles. The swelling might make an adult's scrotum feel heavy. In general, pain gets worse as the swelling increases. Sometimes, the swollen area might be smaller in the morning and larger later in the day. How's it treated? A hydrocele usually doesn't need treatment. Surgery is the treatment of choice for hydrocele, and it is warranted when hydrocele becomes complicated or symptomatic. To remove the hydrocele, a surgeon makes a cut in the scrotum or lower stomach area. Sometimes, a hydrocele is found during surgery to repair an inguinal hernia. In this case, the surgeon might remove the hydrocele even if it's causing no discomfort. After surgery, you might need a tube to drain fluid and a bulky bandage for a few days. You may need a follow-up exam because a hydrocele might come back. Complications of surgery: reactionary hemorrhage, piocele, infection, sinus formation, recurrent hydrocele. Aspiration is another method to treat hydrocele, particularly in patients who cannot tolerate surgery. However, hydrocele fluid almost always reaccumulates within a week or so. In addition, the risk of hematocele and infection after aspiration is high. Aspiration followed by an injection of a sclerosant, tetracycline or doxycycline, has been proven to be effective but painful. According to research data, nearly 10% of newborn infants have a hydrocele, which often clears up without treatment within the first year. Hydroceles occur in only about 1% of adults.